So thank you. It's a pleasure to be here. I'm Cynthia. I'm actually a registered dietitian. I've been a dietitian for over 22 years, within the last 10 years specializing in oncology nutrition. So I'm here today to talk about nutritional interventions for our gastric cancer patients, which we heard today is a vital part. And actually, the way you eat and how you respond to treatment really depends on your nutrition, and we're going to talk about that. So some of the objectives that I'm going to discuss is the risk factors in gastric cancer, some of the dietary risk factors, how a dietitian can play a role, nutrition before, during, and after treatment, your nutritional management of symptoms, the gastrectomy dietary guidelines, and then also some cancer prevention guidelines. So the World Research Fund and the American Institute of Cancer Research actually comes up with a continuous update project, which is a great resource for, they have it for all different types of cancer, but the latest one for gastric cancer was in 2016. And this is actually global research that talks about diet, nutrition, physical activity, and the risk factors and survival. So there is actually strong evidence with increased stomach cancer in consuming 3 or more alcoholic beverages per day, and that's actually new with the latest report. Eating foods preserved by salting, processed meats, and actually that's a high risk with non-cardia. That's basically all the cancers that are not close to the esophagus, the bottom part of the stomach. The cardia is the top part of the stomach close to your esophagus, and that is associated with being overweight and obese. Now, there's limited evidence there with consuming grilled or barbecue meats. Eating little or no fruit can actually increase the risk, and then consuming citrus fruit decreasing the risk. So I love this infographic by the American Institute of Cancer Research showing you that 15% of all stomach cancer can be prevented by having a healthy weight, watching your alcohol consumption, and then avoiding processed meats. So that's about 4,200 cases per year that could be prevented just with diet alone. So what is the role of a dietitian? It's really to give your body the tools needed to help maintain proper function and nutritional needs throughout your treatment process. So some of the goals that a dietitian can help with and our nutrition goals, it actually helps improve your response to possible side effects with treatment, build or maintain strength and prevent body tissues from breaking down. You want to fuel the body to improve your immune function. You want to maintain your weight, preserve your lean body mass, tolerate treatment, avoid complications, and also maintain quality of life. So nutrition during treatment, it's really important to understand how the patient is going to be treated. Are they having surgery? Are they going to be having radiation? Are they having chemotherapy? So nutrition can change in any type of those treatments. So how you eat really depends on how you treat too. So what does the patient need? Just know that protein energy malnutrition is the most common secondary diagnosis in cancer patients. Usually about 30 to 40% before patients even go through surgery are malnourished. After surgery, it can go up to 80%. So it's important when you meet with a dietitian to make sure you're meeting your caloric needs, and that is usually based on your actual body weight. So calories, we usually say about 35 calories per kilogram. Protein can be anywhere between 1.2 to 1.5 kilograms, and then fluids about 30 to 35 mLs per kilogram. And we also want to discuss some of the anticipated side effects that they're having. So we want to get them ready for treatment, and then we would make a personalized meal plan for them. So getting ready for treatment, it's really important for patients to get ready and to ask for help. This is the time to focus on yourself. You want to meet with that dietitian to go over those meal plans with you. A lot of the patients, especially with gastric cancer, they have already lost a lot of weight. We heard that this morning. So it's really important we got to build them back up and get them ready for their treatment and if they're going to have surgery. So we want to make sure that they even fill their pantries with food that they can have ready to eat. If they feel good one day, maybe cook some of their favorite foods and freeze it so they have it always available. And this is the time to ask for friends and family to shop and help for you and cook. So what are some of the common nutritional side effects? So loss of appetite, early satiety, nausea, vomiting, weight loss, diarrhea, constipation, some of our taste changes, and of course, fatigue. So loss of appetite, one thing that I can't stress enough, it's so important to make sure you eat frequently. Small meals, 5 to 6 small meals throughout the day. And when I say nutrient-dense meals, making sure whatever you're having, there's a lot of calories, a lot of protein in a small amount of food. You want to add that protein and calories to all of your favorite foods. Make sure you're just not having a piece of bread as a snack. You want to have something with it, some protein with it. So maybe add some almond butter in there. If it's hard to eat, you want to maybe do a nutrition-dense liquid, a nutrition supplement. There's a lot of supplements out there, and I'll touch on those in a little bit. Also, take advantage of the days that you feel really good. Or if breakfast seems to be your best meal of the day, then eat more at breakfast time. You always want to keep snacks on hand. You want to have something before you go to bed, because before you go to bed, that's a long stretch that you're sleeping, and sometimes you could just wake up really nauseous. And then even sometimes light exercise can help stimulate the digestive system. And then trying new foods. That's one thing I always stress to my patients. Things that they never used to like before, this is a time for them to try it because your taste does change. Nausea and vomiting, you're going to hear again over and over. You got to have 5 to 6 small meals per day. Don't let yourself get hungry. You want to do foods that are easy on your stomach. Nothing that's acidic, nothing that's fried, staying away from citrus fruits. You don't want anything too gassy. So also what can help is taking your liquids, between meals. You don't always want to drink your liquids at the same time. Some of the carbohydrates tend to work really well for nausea. So your bread items, your crackers, noodles, pretzels, things that are salty seem to help really well. Sometimes even ginger or mints can help. Some people use ginger ale. And also, you don't want to wear anything too tight around the abdomen area. You want to wear loose clothes. So weight loss, again, stressing that you make sure you're on a regular schedule. You might not have an appetite, but you want to make sure that you're eating every, couple hours. I always say to patients, 2 to 3 hours, have something with you and eat. Getting that calories, the protein in there. There's great ways to add extra calories into your food. So there's healthy fats. You can do some olive oils, avocados, different nut butters. Protein, you want to make sure every single meal you are having some protein. This is really important for our patients because a lot of them have already lost such a significant amount of weight, and this is how they can respond to treatment. If they continue to lose weight, sometimes they're not even eligible for surgery. Eating meals and snacks in a pleasant atmosphere. Sometimes, being out of the house, opening up the windows, sometimes smells can get to you. And also take advantage, again, of the times that you feel really well to eat. So what are some additional interventions that you can use? There are some commercial nutrition supplements out on the market. Just be careful with, the ingredients in there. You want to look for ones that have less sugar in there. You can also make homemade shakes. I always push food first to my patients. I try to get them to make their own shakes. You could do any kind of liquid base. You could do protein powders. You can add Greek yogurt. You can add avocados into shakes, nut butters. There's so many different things. You can even add some vegetables and fruits in there. There's protein and calorie enhancing products out there. There's some different MCT oils that help with the fat absorption. Pancreatic enzymes, sometimes patients need that if they're not able to absorb fat correctly. And then vitamin supplementation. And then sometimes we have to use alternative means of nutrition support. So sometimes they have to have a feeding tube. Diarrhea. It's really important to understand what is the cause of the diarrhea. Is it an infection? Is it from medicine? Is it just the diet alone, or could it be just the treatment? So you want to make sure you address all those areas. You want to start adding some of the soluble fiber. Soluble fiber is going to decrease the transit time. So that would be some of your oats, your barleys, bananas, applesauce, rice. You want to restrict some of your insoluble fiber, which you're going to get from your fresh fruits and vegetables, anything with the hard skin, some of your whole grains. And then you might need to watch out for dairy products. Some people can develop lactose intolerance, so you have to be careful with that. Usually a Greek yogurt, patients can tolerate, even if they are lactose intolerant, and even some hard cheeses. And then you always want to make sure you increase your fluids. It's really important to stay hydrated while you're on treatment. And make sure when you're using some kind of an electrolyte replacement drink, you are getting ones without sugar, okay? We have actually found that using sometimes amino acids can actually rebuild the GI system, which is really important. Constipation, you got to make sure you're drinking your fluids, okay? Even warm liquids can help stimulate the bowels. You want to increase physical activity. Add the fiber. You want to push the fiber. Now this is the time that we're going to add those raw fruits and vegetables. So we're going to try to get more of the dietary fiber into your diet. Minimum, you should have about 25 grams of fiber per day. And then sometimes you can use some of those sugar alcohols if you are really constipated, because it can sometimes help you go to the bathroom. And then you always want to make sure you establish some kind of bowel regimen schedule. You don't want to go more than 72 hours without going to the bathroom. Taste changes, really important. This is one of the biggest side effects a lot of patients have. Flavoring water, using different herbs and spices with cooking is really important. One of the biggest things that I always tell patients with taste changes and mucositis that can develop is that you want to maintain good oral care. Really important. You can make a baking soda saltwater mixture. I put the recipe on here. That's something that you can gargle throughout the day and make sure that you use, sometimes even just brushing your teeth, but you want to use toothpaste that does not have alcohol in there too. And then sometimes even plastic utensils can really help. If you use stainless steel, sometimes you can get, you could taste the stainless steel silverware, so plastic tends to help. And then fatigue is one of the most common side effects. We hear people complaining all the time that they're very tired. One of the main reasons is they're not eating correctly. So nutrition plays a really big role in fatigue. A lot of our gastric patients become anemic, so they're not eating enough, and you can get really tired from that. So you want to make sure you're eating an iron-rich diet. So you're going to get that from a lot of foods. But when you're eating foods that are high in iron, just be careful you're not drinking coffee or tea, because that can block the absorption of iron. Now, it's always good to have something with vitamin C. Your green leafy vegetables, some of your fruits can help with the absorption of iron. And then you want to always conserve that energy. So when you're tired, take a nap. Stay active. Try to do as many things, stick to your normal routine as possible. And that will also help. So what are some pre-op gastrectomy nutritional recommendations? So before someone even gets ready for surgery, we want them to make sure they meet with that dietitian. We want to start getting them ready to prevent further weight loss. So as early as you can meet with the patient, the better you are. So we're making sure that they're getting their adequate calories and protein, they're getting enough healthy fats in their diet and enough protein, and we're making sure that they're very well hydrated. We want to stick with the small, frequent meals, and then we also want to preserve that lean body mass. So after the first 6 to 8 weeks after surgery, we always say you're going to continue with doing small meals, but we're going to stick with soft, easy to digest foods. So you're going to chew food thoroughly, small bites. You're going to stay away from refined carbohydrates, your sweets, your sugars. That could lead to dumping syndrome. Early dumping syndrome can happen 15 to 60 minutes right after. You can end up with cramping, nausea, bloatness, and then you can also develop delayed dumping syndrome, and that could be 2 to 3 hours after, and that's usually when somebody gets the sweats. They get hypoglycemic. So it's really important to kind of limit the sugars that you're having because it sometimes will empty into your stomach too rapidly, into your system. So you also want to avoid greasy and fried foods. You want to make sure that every single meal, I can't stress enough, that you want to get that protein. And protein, you're going to find your eggs, your dairy products, your meats. You know, there's a lot of grains now, a lot of ancient grains that are very high in protein. So you want to make sure every single meal has some source of protein in there. Nuts are a great source of protein also. And then you want to restrict the fiber. It's really important to make sure if you're eating foods with fiber, it has less than 2 grams of fiber per serving. And then sometimes even laying down after you eat can also help with the movement of the food. And then avoiding fat, high quantity of fat. And then after that initial phase, a lot of people ask, well, what do I do next? So the one thing you want to start doing is start reintroducing the food. But remember, you have to go slowly. You want to add one food at a time. You want to keep a diary to monitor symptoms. It's really important for when you are working with your healthcare professional and a dietitian for us to know which foods you can't and can't tolerate. And then you want to start adding the fiber back into your diet. So you want to start with that soluble fiber, and then we're going to transition into the other foods that you have. So it's really important, vitamin and mineral supplementation after surgery is because with the loss of digestive enzymes and your stomach acids, you know, can be affected with your protein, your vitamin B12, your folate, iron, and calcium may all be affected. So we usually recommend a daily vitamin, and you want to have some source of iron in there. We usually say chewable or a liquid vitamin is usually easier to be absorbed. Iron deficiency is very common, so you want to include those sources of the vitamin C, like I mentioned before. Long-term bone health is really important, so you want to make sure you're getting your calcium, about 1,500 milligrams per day, and you want to split that up. Your body can't absorb more than 500 milligrams at one time, so you want to always either take it in the morning, afternoon, or night, but you want to make sure you don't take it all at one time. And then your vitamin D, you can also add your vitamin D with your multivitamin and your calcium too. B12 is really important, but you want to make sure your doctor's checking your levels. So to make sure with, you know, your B12 levels to see, we usually start about 1,000 micrograms daily, and then you can usually move to once a month. And then the folate, usually we would say like ferrous sulfate is the best absorbed. So the treatment's over. Now what do we do? So this is the new American plate. You want to aim for meals made up of 2/3 or more from vegetables, whole grains, and fruit, and beans, and about 1/3 of it from your animal protein. A little bit different from the standard American diet, which is usually about 3/4 of the plate from protein, animal products. So we want to move towards this new plate. And then this, I know you probably can't see the bottom, but the small infographic is from the American Institute of Cancer Research, and it's a great recommendations just for cancer prevention. So when someone's done with their treatment, usually what we say, cancer survivors really should follow the recommendations for cancer prevention. And that's basically being as lean as possible without becoming underweight, being physically active for at least 30 minutes every day. You want to avoid those sugary drinks, limit consumption of your energy-dense foods. Those are your sweets. Add more of your plant-based foods, your whole grains, your vegetables, your legumes. You want to limit consumption of red meat. The guidelines are 18 ounces per week of red meat. Red meat counts for beef, pork, and lamb. A lot of people think pork is the other white meat. It's not. It's considered red meat. And you want to avoid any of the processed foods. It's really important, the luncheon meats out there that people are buying, they're thinking if they're buying the nitrate-free meat, it's actually healthier. It's not, because they're usually adding celery seed in there, and celery seed also is a form of nitrates. So you got to be careful. So it's still processed, so you want to avoid all those processed meats, you know, hot dogs, salami, so bacon, that all falls in that category. And then you also want to limit your alcoholic drinks. So it's 2 for men, and what counts is 1 serving size, a 12-ounce beer, 1 ounce of hard liquor is a serving size, or 5 ounces, of wine. So it's 1 for women and 2 for men. if you're going to drink at all. And you want to also limit the consumption of salty foods and processed foods. You do not want to use supplements to prevent cancer. That's really important. A lot of patients come to me, what's the magic pill? What can I take? What do you recommend for me to stop this cancer? There's not one magic pill out there. It's the most important thing is you want to have a balanced diet. And then they also have as a recommendation, if you can breastfeed your baby. That's a recommendation. Well, thank you.
Thank you very much.
You're welcome.
So I'd like to welcome Victoria Burgo, who's the founder of Vivra Health, who's going to join our panel, and also Marie Milton, who's here. So I'm going to open up to questions. We have just a few questions because we're severely over time. Does anybody have any questions from the audience? Please, go ahead. We need a mic in the front.
On my way.
I just have one quick question, and that's about the 5 to 6 small meals a day. People tell me that all the time, and I have a real hard time with it because if I'm going to eat breakfast, lunch, or dinner, I have a good appetite, and I can eat a regular meal. And I don't want to eat half that meal and put the other half away because in 2 hours or 3 hours, I won't want to eat it. So I really have a hard time with the 5 or 6, and everybody says to do that.
So usually the reason why we recommend 5 to 6 times a day is that you can get a little bit more in. So if I have somebody who's doing breakfast, lunch, and dinner and they're able to meet their calorie needs with 3 meals, I'm okay with that. But sometimes you have to add little snacks in between.
Oh, I do that too.
Which is important.
And before bed and whatever.
Right.
Yeah.
But if you're telling me for breakfast you're having a piece of toast and coffee and that counts as a breakfast, then I would have to adjust your diet.
Right.
Okay. I have a question that came up here. How can I combat acid reflux? I don't know if Victoria, you can answer that, please? Thanks. You have your own mics.
Yeah, okay. So with acid reflux, a couple things that you guys can do is really try to reduce the amount of acid or the types of acidy foods, such as tomatoes or whatnot. The other thing is the way that you eat, like maybe sitting up or laying down sometimes help. But the greatest way is really to avoid fried foods. I think that's really important. And really try to do maybe more soft foods or well-cooked foods. So that would be some of the ways to really deal with that.
Mm-hmm.
And then just to add, do you have to be careful also, even caffeine can affect you. Chocolate can affect you. Any citrus fruits can also affect you. So it's really important, even dairy. So you got to be careful and find out what foods you can tolerate and can't tolerate, even carbonated beverages.
Mm-hmm.
And just to add on, because I think it's really important, is to also ensure that you're hydrated throughout the whole day. So I know that's really difficult to do. Again, just like Cynthia was saying, really avoid the carbonation. So if you want to have something like that, maybe try to squeeze some fresh or even infuse your water with cucumbers or something like that so you have a different taste throughout the day. I think that's really important. With that, sometimes your skin gets dry, so it's really important. With the amount of water that you take as well, it will help you with any GI issues, the constipation or the diarrhea that Cynthia was talking about. And that's one of the ways that you can combat some of these symptoms that you're having.
Great, thank you. Any other questions in the audience? I'd like to see if, Marie, can you tell us a little bit about your nutritional issues that you had during treatment? What your mother had during treatment, and any tips you can give to the patients?
Yes, my mother was of Korean descent, so it was a big cultural shift than what the nutritionists that we had was used to, and we also did not see our nutritionist till later. I really encourage everyone to make your nutritionist and dietitian your buddy, because we thought we had it under control. My mother was a very avid, wanted to make sure everything was healthy and plant-based and not too much of this bad meat in all her life. But still, with stomach cancer and her getting very disinterested in food, very disinterested in eating, and then I found myself buying everything under the sun and making so many different things. And what I found, a tip, was I made a list of what the dietitian and nutritionist told me. This was when she had radiation. My mother had surgery, chemo, radiation, high-pec. She had many things. And the hardest one was radiation, I'd have to say, as far as her appetite. But I made a list of the foods that the dietitian said, we want to integrate these at this time. Let's think about that. And I was like, none of her Korean foods work, and she doesn't like that at all. That makes her nauseated. So I told her about this Korean dish has this in it. So you might want to be prepared with what you put in there and talk about it, because they might say, well, how about you try this instead of that? Tastes similar. And we try it. My mom would actually like it. And I'd go through that one food at a time. Like you said, you introduce it slowly because she was so disinterested. So I would introduce it very slowly. And as a caregiver, you're stressed, you're tired, you don't remember. You buy 10 things because you're like, this will taste great. You're like, okay, maybe not. I would touch that one food. She liked it a lot. I would freeze. I did a lot of freezing of food because sometimes I have 2 kids. I'd have to leave. I lived at her house 50% of the time. She was in Texas, I was in Florida. So she could grab it out, warm it up. She knew it was healthy in her mind. She did not like processed stuff. So it was really and I'd call her up like, Mom, don't forget to take out that frozen bag in the morning so it's ready in 3 hours for you. So the tips of slow integration, freezing our foods were a huge plus for us because, again, the fresh stuff could be made ready right there. And then, if she changed and said, I'm not digesting this well today, then I'd be like, maybe we need to pull back on this, and we just kind of exercise through that. And that was a really hard process. You hear a lot from, you're like, okay, we've got to follow this, but all I have is this right now in my pantry. I don't even want that nutritionist to look at my pantry, but, it's worth it to work through them and the drinking throughout the day. My mom always did warm fluid, but she did smoke 20 years. After my stepdad passed, she drank a lot for those 2 years post as a widow. But she ate really well throughout her life, and so I really encourage and I like to mention the smoking, because if, you didn't smoke, eat really well. Really follow that, because with all that, my mother's habits, I really believe that had a negative impact, and nutrition and diet's such an important thing.
Please.
Just to add on, there are resources out there to help patients. There's actually a specific resource out there.
Can you hold the mic?
Oh, there is a specific resource out there to help you with, making food and drinks and foods that are really infused with a lot of protein. So you guys should go check out stomachcancerwellness.com, which actually goes through the various ways of helping you while eating, as well as how to infuse, protein and other caloric ways of things in your meals. So that's another really good resource for gastric cancer patients, especially for caregivers that are struggling to cook for their family members. And that happens often.
Thank you so much to our nutrition panel.